Good afternoon again. We're going to start. So welcome to our session on the regional, on the Eastern Mediterranean region to discuss the EMT specifically within the scope of our region, the progress, what are the initiatives, what are the responses that have been in place. And we are really happy to have you here, the interest from the different countries, as well as the partners and the delegations. So first, let me introduce myself. My name is Samar Hammoud. I am from WHO, specifically from the Regional Office of the Eastern Mediterranean, and working on operational readiness and capacity building, under which we have the EMT initiative embedded and supporting our member states accordingly, from the preparedness part until to the response. And today I will be moderating and supporting in this session. I have with me as well our colleague, Dr. Hisham Dinar from Saudi Arabia, who will be as well facilitating and chairing the session along with myself. Yeah, thank you. So as a start, I will just have a general description of our session. As I said earlier, it will mainly consist of having an introduction of the EMT initiative in the EMR region, Eastern Mediterranean region. And we will be having presentations by our regional office, as well as specific contextualized presentations on the EMT initiative within a selected list of our countries. And this will be followed as well by some discussions and, of course, follow-up questions. We are planning to have at the end a panel discussion specifically addressing our regional action plan that has been put forward and drafted. It's not still endorsed, so we are benefiting from our gathering today and this platform in order to try to identify our priorities with respect to the regional action plan and the specific recommendations or actions under that plan. So the whole purpose, or one of the objectives, of course, once we endorse or at least we prioritize our actions within the regional action plan, is to align it along with the EMT 2030 global strategy. This would come again along with the country experiences that we're going to share throughout the session. In terms of specific or first overall objectives and then specific outcomes from our session today. So as I said earlier, we're planning to introduce the new EMT 2030 strategy with proposed objectives and priorities, providing an overview of the EMT initiative activities within the EMR, and hoping to convene through the discussions on the regional action plan, our regional working group that we are proposing to put forward, and we are still having nominations from the different countries. Yesterday, during the special advisory group, we had progress updates from the different regions, and as part of our update from the region is the follow-up on that governance structure for EMT within the Eastern Mediterranean region through establishing that regional working group. And this, while identifying specific national focal points from the different member states, that we would be gathering, having a formal working group and having specific TORs and working together into moving the regional action plan. So again, we're going to benefit from our platform this afternoon in order to try to reach that objective. We were supposed to have our regional emergency director with us to start and to give us a little bit his briefing or his insights on the response within the region, and specifically using EMT capacities. However, due to a last-minute engagement, he had to withdraw. So we hope that he will be made available throughout our session and he could join later. So without further ado, we're going to proceed with the presentations. But maybe before that, just having a quick round among the audience to know who are the delegations from our member states that are presenting and that they are present with us this afternoon in order to know more about the audience, and of course any specific partner or organization that are interested in the support for our region. So maybe the delegations from the different countries could just like introduce themselves, and we know who we have on board for our session. I don't know if you want to start with the Kingdom of Saudi Arabia, maybe? I don't know if do we have a mic? Dr. Hisham, but if you can wait, if you want to have the mic.
Assalamu alaikum. Good afternoon, everyone. My name is Hisham Ali Dinar, with the Saudi Disaster Medical Assistant Team representative today. Nice meeting you, everyone.
Good afternoon. My name is Samir Nizi. I'm the Deputy Director of the National Health Emergency Operations Center at Ministry of Health.
السلام عليكم. أخوكم مرعي العمري، مساعد المشرف العام للطوارئ.
السلام عليكم. مهندس منصور الغشام، قائد مسار اللوجستي.
Assalamu alaikum. My name is Wafid. I'm paramedic. I'm the Saudi DMAT project manager. Thank you.
Yeah, here you go.
Assalamu alaikum. Good afternoon. I'm Dr. Muhyiddin Hassan, leading the emergency care and ambulance agency in Sudan, EMT focal person.
Hello everyone, my name is Dr. Ibrahim Labib. I'm an emergency medicine specialist and disaster medicine specialist. I am the Director of Crisis Management and Public Health EOC in Ministry of Health of Jordan.
Assalamu alaikum everyone. Dr. Hamdan Hilan, focal point of Libya, with full delegation Yunus, Dr. Muhammad, Dr. Abdurrauf, Dr. Hassan from Libya, EMT.
I am Dr. Ahmed Al-Azab. I am the General Manager of the Disaster Preparedness and Response, Egypt Healthcare Authority.
If we can start, please, with our hosting.
Assalamu alaikum wa rahmatullah. Dr. Walid Skete, Head of Emergency Operations Center, Dhahra Region, Amman, Consultant Emergency and Medical Toxicologist.
Assalamu alaikum. This is Dr. Muhammad Al-Abri. I'm Public Health Officer at WHO Country Office, Oman.
Assalamu alaikum everyone. I am Dr. Sahar Mashal, the Clinical Governance and Audit Manager for National Ambulance. Our ambulance services working in Northern Emirates, in Ajman, Sharjah, Al Quwain, Ras Al Khaimah and Fujairah. Thank you.
لو سمحت بس المايك بأول صف. Here.
Assalamu alaikum. Dr. Sahal Bayad, Director Health Emergency, Ministry of Public Health, Qatar. And with me is Mr. Brendan and Dr. Ahmed Al-Mohammed.
Assalamu alaikum. And welcome everyone to United Arab Emirates. I'm Dr. Fatima Al-Attar, Consultant and Director of International Health Regulations, Ministry of Health and Prevention.
Good afternoon, everybody. This is Dr. Wadad Al-Maydour, Consultant and heading the Emergency and Operations Center in Emirates Health Services in the Northern Emirates.
Assalamu alaikum. My name is Dr. Hussam Abu Alwan. I am EMTCC Coordinator at EMRO, Cairo.
Any specific delegation that wants to introduce, or we can move ahead? Okay, please.
Hi everyone, this is Haytham, Dr. Haytham Bashir. I'm the Public Health Emergency Management Center at the Eastern Mediterranean Public Health Network, EMFNet. Glad to be with you here. Thank you.
Okay, welcome. So, yes, please, there.
مساء الخير. My name is Dr. Yanal Ajloni. I'm Jordan Paramedic Society President and also the team leader for the EMT in Jordan.
Okay, أهلا وسهلا. Yes, please, and we'll move on.
Hello, my name is Bart Kruijs. I'm not from the region itself, but I work with Hospitainer and we work together with many EMTs in the region. Interesting to learn.
Thank you. Okay, thank you for being here once again, and we're happy to have representatives from many of our member states. So we will move along with the country presentations. We were supposed to have our colleagues from Pakistan, but due to some impedance in their travel, they could not join us. So we're going to skip the presentation from Pakistan and move directly to the one from Jordan. Dr. Labib, if you'd like, please.
السلام عليكم ويعطيكم العافية. أنا الدكتور إبراهيم لبيب. هنحكي عن ال EMT initiative in Jordan, where we are and how far are we from the certification. That's my name. So it all begins here, you know, like when we have like emergencies like that, like traffic accidents, flash floods. Our area like is prone to many disasters, especially like natural disasters are happening more often in our area. So it all begins from here, that we think that we need to respond faster, we need to treat people faster. As Ministry of Health, we are treating more than 65% of the population in Jordan, which includes about 2 million refugees. So the initiative started and we submitted our application for the EMT Emergency Medical Team MOH Jordan. And then we started our preparations. So what we are looking to do in 2024 is to finish the layout and the protocols and be ready for certification visits before the end of 2025. Hopefully with the collaboration of our regional office, we will try to be certified. I don't know, hopefully, because usually it's a lengthy process. It takes about like 3 years. on average to get certified. So EMT in Jordan, we already have it. We already have 4 national teams and 15 subnational teams. A total of 478 members in those teams. And those teams get activated, I will say maybe every month or 2 months at least, so a few times every year, as I will discuss in the next slides. So we have worked on the team capacity building. We do have simulation drills twice a year, and those drills usually are on the national level, which include, more than one entity. So the next drill that we are doing is going to be in December, and it includes 38 government entities is going to be in this drill. As well as training courses, so we have kind of like a monthly quota for the people we want to train every month on mass casualty triaging, mass casualty management, disaster management, and stuff like that. So all of course, not to mention, like the basic stuff like basic life support, advanced life support, and stuff like that. When it comes to policies and SOPs, so we have the EMT deployment SOPs. It's already in place, already signed by His Excellency the Minister of Health, and was approved. Mobile clinic triage policy, mobile clinic wound care policy, and the pain management policy, SOP for the PHOC activation, already signed by His Excellency Minister of Health. Regarding our supplies, so Ministry of Health already have many stores across Jordan. The good thing that we already have a system in place, and we just updated actually our store, so it's all going to be using the artificial intelligence. Like how much exactly of each supply that you how much that you have, and like if there is something is coming in the way, the system will let you know when it's the next shipment is coming. So regarding supplies, we can track it in the warehouses of Ministry of Health, which is well distributed across Jordan. We did face some financial difficulties, with some of the equipment that we went to get. However, recently Jordan just proposal for pandemic fund was just approved, and a good amount of that is going to support for the EMT. We already know what we want, like we already have kind of like the layout, already have, steering committee for that, and we also, have all the services that we want, starting to put everything in place. I'll speak briefly on the EMT deployment. So we had on 13 December 2023, we have a major traffic accident, which was university students were going from Amman to Irbid, and the bus flipped over in a valley. Response time for the EMT, one team was deployed. The response time was less than 30 minutes. And 80% of the 25 members of that team showed up at the hospital. 42 casualties, they were treated in 2 hospitals, and they were treated in less than 2 hours. January 5th, actually same area, same team was deployed. It was a Friday afternoon. Response time, same thing, less than 30 minutes. One team deployed 25 members, a 60% response rate, 60% of those people showed up actually to the hospital. 21 casualties were treated in only 1 hour. Chemical inhalation incident, and this is recent, just last September. Response time was 36 minutes. One team was deployed, 25 members. This was really fascinating. I was there on the ground, 100% response rate. All 25 members were able to come to the hospital within less than 36 minutes. 135 casualties were treated in under 3 hours in 4 different hospitals. To be quite honest, the good thing about this incident, it was only inhalation injury because there was like a leak from the fumes from the factory to the neighboring factory. So it was only respiratory symptoms, and everybody was, I will say, most the injuries were very simple. I will stop there. I don't want to bore you with my talks. And thank you very much. If anybody have any question, I can answer them. Yes. So what we are using for now is WhatsApp groups that we have like all the teams, and then we send the message, you know, like what's happening, where do we need you to be, and we send like even the location if somebody is not familiar with the location and stuff like that. On the other side, we are developing an app internally with our IT department to replace the WhatsApp. And we are piloting it. I think maybe early 2025 it will be active. Any other questions, please? Go ahead. Oh, that's very easy. Okay. Okay, you made it easy for me to answer. Our staff, our members in the EMT teams are MOH employees. And usually when there's any like mass casualties by the public health law in Jordan, everybody can be treated for free in government hospitals or even in the private sector. MOH will cover it. So you can send the patient to any hospital. We send them the supplies and send them the staff, and that's it. Anything that is a mass casualty under the public health law is covered by MOH. For example, for the COVID response back in 2020, Ministry of Health, we treated Jordanian, non-Jordanian refugees. All were treated for free, zero charge. Even if you're like Jordanian and like you don't have insurance or anything. Mm-hmm. Go ahead, please. Yes. No, so all our teams are have specialized training. All our teams have specialized training in trauma care because the most hazards in Jordan are road traffic accidents. And with the help of the military, so they have like a chemical unit, they call it. So every month we send somebody from Ministry of Health to be trained on decontamination. That's one thing. And actually, if you maybe I should have included like more pictures, but within the simulation exercises that we do, usually at least once a year, there will be like a chemical scenario in the simulation exercises. So the one we did in Aqaba this year, yes. This year involved like a chemical scenario, and the casualties were taken to the Aqaba Sheikh Zayed Hospital, and there was like a decon station was set in the front of the hospital. And actually back in 2022 we did have the same exact incident, so we just simulated this almost the same incident that happened for real in 2022, June of 2022, where we did have a chlorine gas leak in the port of Aqaba. So everybody in the team is either CPR untrained or will be trained within the next coming months. Any more questions? I forced them. No, so as I said, you know, like we have sub-national teams. So Aqaba, the city itself is not that big. So I have people in Aqaba, I have people in Amman, I have people in Irbid, I have people in Karak, I have people in Tafila, I have people in every single city, in Mafraq. I have 15 sub-national teams. So usually, actually, like one of the incidents, you know, like one of the nurses, he showed up to the hospital with the flip-flops. You know, because he lived, you know, like across the street. He was like, if I'm gonna take my car, it's gonna take me longer. So he just crossed the street to the hospital. So I usually believe in building local capacities, because those local capacity you are going to need it to respond in the first few hours. Because no emergency medical team will come, you know, like to travel from one city to another, or from like one country to another, like within few hours. And even if they did, they will arrive tired. So my focus is to build local capacities in every city. Amman, because it's crowded and we usually have traffic, so we have in Amman 3 teams. Okay, thank you all.
Thank you. Thank you, Dr. Labib, for sharing with us the efforts in Jordan in building up the national teams and your future plan into that perspective. Now we're going to move to Kingdom of Saudi Arabia, and we're having Dr. Hisham Dinar sharing with us the progress towards EMT classification and the capacity building efforts in the kingdom.
Just 1 minute to familiarize myself about the, you know. Assalamu alaikum wa rahmatullah. Bismillah, alhamdulillah, wa salatu wa salam ala rasulillah. Thank you very much for the opportunity of sharing Kingdom of Saudi Arabia classification journey for the Saudi DMAT. And I would like also to thank my colleague here who came with me, and I would like to convene the General Supervisor. Salutations towards everyone from you, and hopefully within the next few minutes I can try to reflect and summarize the efforts being in place towards the classification journey of the Saudi DMAT. So perhaps you're all familiar about the classification process that has 7 steps. Each step represents a progress percentage to be classified, and an average time that can be taken by each EMT interested in the classification process. So we already covered the steps from 1 to step 4. And as a Saudi DMAT, we have already covered these. the remaining are only 3 steps that represent 25% of the overall process. That's to say that we have the pre-verification visit and the verification visit itself. So how did we reach here? That was a long journey to start with. I'm going to take you step by step how we did that as a country and the collaborative efforts between the relevant stakeholders within Kingdom of Saudi Arabia. A few contexts about emergency management in Saudi Arabia. The field's operation in general is led by the Health Emergency Operation Center. As you can see here in this slide, we have the National Health Emergency Operation Center that is located within the Ministry of Health, and it's connected to 20 regional health emergency operation center through the countries. Each one is a replica of the National Health Emergency Operation Center, and that's not a result of a coincidence. That's a result of the leadership direction and the ambition vision of Saudi Arabia 2030. So the multi-sectoral coordination within emergency management is very important. And what you see here is a simulation of how different sectors interact when it comes to emergency within the Ministry of Health and the Regional Health Directorate. The message here we would like to share that it's very important when it comes to emergency and the operations of the emergency medical team to think about all the levels within the country, national, subnational, and even local within the healthcare facilities. So where does the field operation, the Saudi DMAT, locates within the National Health Emergency Operations Center? It falls under the operation administration, where it has different unit. We have the deployment and demobilization unit, and we have the team's roster monitoring and evaluation unit, and we have the operations infrastructure that is responsible about the field hospital for the Saudi DMAT, and there's a unit that's responsible for the initiatives that support the improvement of the Saudi DMAT operations. So we have 5 emergency response levels in Saudi Arabia. However, the Health Emergency Operations Center operates in 3 operation levels. Each level interacts with the other. The idea here is to have a very objective, precise way to identify what, when, and where to use the resources that the Health Emergency Operations Center has. So the level 1 operation is basically the day-to-day work of the EOCs, and the partial activation of the EOC is represented by level 2, and level 3 operation is full activation of the EOC, and we expect here to have the Saudi DMAT deployed depending on the stress on the health system within Saudi Arabia. Now, towards the classification of the Saudi DMAT, this has been one of the initiatives that's been transformed to a project. That project bears in hand the vision and the mission of the Saudi DMAT as part of the Ministry of Health's strategic objectives. All right, so for the project, we have 7 tracks. The first track is the operation track that's responsible for the medical component of the Saudi DMAT. We have the exercises track, which is responsible for the capacity building. That's to say, Saudi DMAT member training, simulation exercises, etc. And we have the logistic track that's responsible for the services and the healthcare facility owned by the Saudi DMAT, the deployment of the hospital, the setup of the hospital itself. We have the technology and admin and finance track, and at the end we have the classification and strategic partnership track. So this picture shows the visit by the mentors that occurred 2023. But the idea here is the unique approach that we adopted is the hospital incident command system that help us to even facilitate the work in this project to achieve the requirements for the classification. Now, there are key principles that we carried out through this process. We need to have a clear plan so that we fulfill all the requirements of classification. That's what we did as a Saudi DMAT. Also, we have regular meeting session at 3 levels. The first level is the team huddles themselves, the DMAT team huddles, and we have regular meetings with our leadership within the Ministry of Health. That is led by the General Supervisor and the NHOC Director. We also have regular meetings with the mentors to show progress and get insights on how we improve our work towards the classification. We also consider the stakeholder engagement, which is very important. We are proud to say that in Saudi Arabia, we have a unique partnership with the Public Health Rapid Response Team, the Infection Prevention Control Rapid Response Team, and also the Nursing Rapid Response Team, and the most important one is King Salman Center for Relief and Humanitarian Aid. Also, the innovative approach. We always think about going beyond the minimum standards to be innovative in our approach, and that's why we focus on fulfilling the minimum standard and go beyond that with innovative approaches. I'm going to show you some examples of that. And of course, it's very important to strike a balance between the response and preparedness, and here comes on how the DMAT maintain the response capacity through the year. And what makes that easy is having the Hajj season every year that allow us to assess and evaluate our capacity in a mass gathering setting. So the journey starts back in 2019, where we submitted the interest for classification. And then due to COVID-19 pandemic, we have the mentorship session virtual, and we thank our colleague in EMRO office, WHO. And then we have the first visit in 2022. The mentorship visit also occurred in 2023. The previous picture and the picture down there is showing that visit. And lastly, we have the last one in 2024. And I don't see Dr. Hanna here, but anyways, we thank him among the other. Yeah, thank you very much for your support. He's one of the mentors that we've been lucky to have him during this process. Now, how we maintain the capacity, as I mentioned, we're lucky to have the Hajj season as part of our annual activity. And it's not without a base. It's very important to consider the all-hazard approach emergency readiness to enhance the preparedness of the Saudi DMAT. So the risk assessment is one important area that we consider prior we plan for our training or capacity building activities or simulation exercises. So the message here is all hazards approach, emergency response and preparedness is very important. Now, how this works actually is absolutely related to several emergency plans within the country. The complementary approach between the concept of business continuity planning the surge capacity planning, the general emergency plan, and hazard-specific plan is a recipe for that. We have 5 surge capacity level where we activate the mobilization of the Saudi DMAT as part of this level. We already have a template for all healthcare facilities to plan for surge capacity as well. We expect to deploy the Saudi DMAT in level 4 or 5 because we reach here to the peak of stressing the health system. This approach helped us a lot, especially during COVID-19. And thankfully, during COVID-19, although the stress of the health system, we never reached to the point of health system breakdown in Saudi Arabia at all. And that's one of the important tools that we use and help us to be very objective of when and how to mobilize our resources in response to an emergency, and the DMAT plays an integral role here. Capacity building through simulation exercise is very important. That's Saudi DMAT also, we're adopting the building block approach. It's not all operation-based exercises. We go step by step based on the need. What you're seeing here is the example of the simulation exercises that we are doing during Hajj.
وردنا بلاغا عن حالة انقلاب الحجاج. كرم بالله الاستعداد واستقبال الحالات.
يلو في المستشفى كان حادث كبير انقلاب يمكن اكثر من 30 حاله. هذا يخلينا نقيس مدى جاهزيه الاستجابه للازمات والكوارث والحوادث والاصابات المتعدده.
And yes, I mentioned earlier the innovative approach for the Saudi DMAT is going beyond the minimum standards. And we're proud to say that one of the standard operation procedures that we develop in the process of classification is to develop the exercise standard operation procedure for emergency medical team or the Saudi DMAT. And the National Health Emergency Operations Center, as a collaborating center with the WHO, will be happy to share all these documentation with the member states to support and to advocate for EMT's classification through the member states. The journey of membership also starts by applying for the interest to join the DMAT. And then there's a selection process all documented in an SOP for training and membership. And also this followed by the training, and upon the successful completion of this training, you will be a member of the DMAT. Another innovative approach that we go beyond the membership training. We are proud to say that we have 3 trainings specifically for the DMAT. The membership is one of them. The second one is for the administrative component of the Saudi DMAT. And lastly, we have one unique training focused on evidence-based practice in emergency medical team to support the research and to support the evidence-based practice in this particular area. And this is absolutely aligned with the 2030 strategy of EMTs. So we use technology for that. This is the AHOP system. The AHOP system is basically the platform used by the health sector in Saudi Arabia for emergency management. We use this system to plan for the training itself. And as you can see, you can have different type of learning situation that range between the online training to hybrid approach or flexi learning that we're intending to apply, inshallah, next 2025 to go to use different approaches for capacity building. And we need to think about the leadership and the executives at the healthcare system in each country when it comes to capacity building. They need to be involved in such exercises, and saying that that's required to have the suitable learning situation for them. A unique approach that we are proud to say that we have implemented is the Hospital Incident Command System. You are aware about the Hospital Incident Command System. So basically, when we are deployed at the DMAT, we use this approach to operate and response. And as you notice, that's absolutely aligned with the WHO recommendation in that area. Now, the deployment process goes through different steps, but in this slide, I would like to show you the flexibility of the Saudi Disaster Medical Assistant Team. So it's a modular approach. It's not an all or none approach. And in that manner, that helps us to manage the resources efficiently and use the proper operation model for a specific response area. So the operation model for the DMAT aligns with the EMT type of hospital. In addition to that, we have operation models that include the public health rapid response team, nursing rapid response team, infection prevention control rapid response team, hazmat, and even command system support operation model. You don't need to mobilize any resources, you just mobilize the personnel themselves, and that's help us during COVID-19 to support in decompressing the health system to cope with the stressing situation with the cases that been surging initially. A good example of that, of how we activate the DMAT in different models in different regions, as you can see in this table, just to emphasize on the importance of adopting a modular approach rather than having it as an all or none approach, because this will help to manage the resources in an effective way. This is what we call the deployment and demobilization journey, and how we deploy the team and then demobilize them. And actually, if you look to the Hospital Incident Command System, you'll be familiar about this process. So not to reinvent the wheel, but aligning with what we have and emphasizing on the importance of aligning with them. We use for deployment, and I hear a question about that today. We also use the technology. We use the AHOP system for the deployment. And as you can see, when we have an emergency that requires to deploy the Saudi DMAT, we use the AHOP system. There is a picture that simulates the roster and how it looks in the AHOP system. It's just we select the member based on the emergency itself, and then there's a message of where it will be the mission and some direction and where to gather. And we have a mobile application for that, so every member will be notified. I'm trying to close within the next 2 minutes, so I'll go faster in here. Yes. Lastly, in preparation of the next step, now we are deploying the full capacity of the field hospital, awaiting for the pre-verification visit. This is how the field hospital looks. So also to support in the future training and the next visit, we also have it in a 3D so that everyone in the members can be familiar with that. This is an example of how it looks. And this approach, we just did this few months ago, and we'll be incorporating this within the next capacity building model. So basically, this is the layout of our field hospital that is deployed for the next pre-verification visit. And some of the challenges that we have, it's very important to think about how we can strike the balance between the preparedness and response, and also the health transformation within Saudi Arabia, which is the largest in the globe, actually. That requires to look at it as an opportunity rather than a challenge. The challenging situation of deploying in very difficult infrastructure is a good thing to look at. This is the example of the deployment of the field hospital within Hajj with a very delineated area. And yeah, key takeaway messages, and I close by that 7 things. It's very important to have the leadership engagement, and this is what we are proud of. All the leadership are there supporting each single step of the classification process. Planning is very important, and also effective communication, whether during the response or even during the project itself, is one important area. And again, striking the balance between the response and preparedness is very important. We need to be flexible in our approach, and the modular component of the Saudi DMAT is the emphasis of that point. And multi-sectoral coordination and engagement is critical as well, because we cannot work in solo within the country, and that's very important to consider. And the technology is essential, but you can go without the technology. However, when you have it, it will facilitate a lot. Thank you very much, and sorry for taking long.
Thank you, Dr. Hisham. That was really inspiring. And of course, you can have your contact benefiting from like the ongoing, of course, EMT meetings, so that we can have bilateral maybe discussions with other delegations to benefit from that journey and share the experiences. Now we're going to move, maybe we can keep the questions till the end so that we can progress in our agenda. So we're moving now to Dr. Hussam Abu Alwan in order to present to us the EMTCC coordination cell setup for Gaza operation. Thank you.
Assalamu alaikum. Just I would like to start to thank Dr. Hisham for his presentation. He raised our hope. I would like to express at the morning when the opening of the meeting, we see a lot of classification out of our region, but now we are hoping that our region is going to be having more classified EMTs in the region. So I am going to tell you today about the EMTCC setup for Gaza response. It's a unique response in Gaza. Gaza is before the last escalation and war in October 2023. It was a fragile system. It is exposed to emergencies many times, frequently. So some experts call it as a chronic emergency, Gaza. But the last one is the huge one. No one expects this duration of crisis continue in Gaza. So Ministry of Health, local partners, and WHO addressed the needs for international and national EMTs to support Gaza. You know, EMTs at response can help to improve, sustain essential health services, and to support the health system in the country or in the affected region to resilience and provide the service for the people in need. As I mentioned, before 7th of October, Gaza was struggling and with a lot of strains, with a lot of difficulties with access. It's a chronic emergency. Since October of 2023, you know everyone what happened in Gaza and how escalation is started. No one at that time expected that the duration will continue 1 year, and we are in the second year of the conflict. In November 2023, Ministry of Health and local partners asked to activate EMTs and to ask for more support from the global, from international teams to support Gaza. In December 2023, there is an activation of EMTCC, and we have a special, unique situation in Gaza. We have 2 EMTCC, it should be 1, but due to access issue and the difficulties inside Gaza, we have 2 EMTCC. In January, the first team arrived to Gaza. Crisis started at October, the first team arrived in January. If you look to it, it's a long time, but for Gaza, as I mentioned, it's a unique situation. The access to Gaza, not for the team, for the supplies, for everything, is an issue and not easy. This is the module that we are follow, how to have the EMT coordination cell. This module should have coordinator, deputy, liaison, everyone in this cell have a specific task and rule to support the deployment of team in affected area or crisis. We have, as I mentioned also, 2 teams, one in Gaza, one in Cairo. In Gaza, we have coordinator and international and national coordinator. We have in Cairo a bigger team, coordinator with deputy, with admin and technical officer, with information management officer. Also, we have supported by seconded staff from Europe countries, from Japan, from other. They are support the EMTCC deployment in both Gaza and Cairo. This is our picture of our team in Cairo and in Gaza. You see in Gaza, they are in the field. In Cairo, we are in the office, EMRO regional office. So what is the mandate? What is the task? Why we have to set up for Gaza response? In Cairo, we are scanning the needs, the interested teams to be deployed in Gaza, going through the registration process, going through the facilitation of entry and the travel through in and out to Gaza. All of you know the closure of the border, the changing from, it was started the deployment through the Egypt side, now through Jordan side. So there is a lot of difficulties that need to be supported for the team to be deployed in Gaza. In another side, the EMT inside Gaza, it is scanned with the local partners the needs, to match the needs, to ask Cairo EMTCC to support based on the gaps to be filled from our sides from Cairo. Also, it participate and represent EMTs in all the meetings with donors, with the local authorities, with partners. So this is another picture from EMTCC office in Cairo, how it looks. We started in Cairo, honestly speaking, with 1 person at the beginning. Then we start to expand based on the need and to support based on the demands. What is the achievements? EMTCC, at the beginning, we faced a lot of challenges, resistance from local authorities to start. They thought there is no need for EMTs. But later on, they realized that the EMT can support in different level. They can support the system to sustain, not to go to collapse. So, as you see, I will mention, for example, it's involved in the emergency preparedness for the current time and after ceasefire. They are supported the SOPs and guidelines for referral system. There is a coordination for the deployment for more than 24 teams to be deployed. They support referral. They support e-wards, surveillance system. Also, they support MWAC and the screening for the malnutrition cases in Gaza. If we are going to speak in numbers, right now, we receive more than 1,800,000 consultation in Gaza from EMT network. More than 30,000 surgery conducted by EMTs in Gaza by EMTs. We have 44 partners, 24 deployed in Gaza. More than 1,000 international staff deployed in Gaza. Also, we have specialized care team that they support the health system inside Gaza, supporting the public hospital by sending team. As Dr. Hisham mentioned, there is a command team sometimes, not fully deployment, but there is a specialized care team that can support the hospital and public hospital. Also, the access issue, the coordination for teams, entry and exit. Sometimes we receive denial, sometimes we need to support and to process more than 2,500 requests for travel to enter and cross Gaza. What is the priorities? Number one priority is to maintain the access. You know now Gaza, North Gaza, there is no access for our EMTs. Access is the main challenges that we are facing. Number two, adequate protection. If we manage to deploy team in the needed area, we need to secure their presence, the protection. This is another issue. It's not only access, also the protection. And the access, again, to facilitate humanitarian work and access inside Gaza. The first one, to maintain access from outside to inside, and the movement inside Gaza is another challenge for the EMT. And finally, the safe and comprehensive pathway for trauma care. We have trauma care pathway established in the OBT, started from the scene of the injuries to the pre-hospital, hospital level, secondary level, and tertiary level. This is the trauma pathway of care that we are working with partner to strengthen this pathway. The main challenges, as we mentioned, the needs, and this is the challenges. Increased security concern due to the evacuation orders. We have some teams in Gaza deployed, but unfortunately they have to be evacuated due to security concern. Limited number of seats for travelers. We have very small, slim, or window for the rotation of the teams in and out of Gaza. And the last one is the supply chains. People without supplies, they cannot work. So the challenges of the access is not only for the team, also for supplies. There is a lot of coordinations behind any process to admit or enter any single supply to Gaza. This is another challenge for the teams. Sometimes we are successfully managed to deploy team in Gaza, but finally there is no supplies, so they cannot do anything. This is the video summarize our collaboration with EMTs in Gaza. I don't know, we need to activate it from colleagues, IT colleagues. Oh? No. Not working? Very interested video from Gaza. Sorry. It not work? Yeah, okay, okay. Yes, this is the last slide. We have also, for those who are interested to follow Gaza response, we have dashboard. You can scan this and follow in weekly basis the dashboard that we upload and feed with all the data from Gaza. Thank you very much, and I am ready for any questions or comment. Thank you.
Thank you, Dr. Hussam. So we're going to move now to a regional presentation from our colleague, Dr. Sama Al-Mutawakkil from the regional office. She is the focal point of the training and leadership program, as well as the Global Health Emergency Corps in EMRO. So she will take us through the journey, the introduction of the initiative, and how we could somehow implement it and have it in place in our member states and countries. So Dr. Samar, over to you. Dr. Samar is not with us, unfortunately, so she's joining online, and hope the technology will help us in having her. Yeah, so she's with us.
Thank you so much, Samar. Can you hear me?
Yes, it's good.
Perfect, thank you. Hello, everyone. Unfortunately, I can't see you, but today I would be with you using the technology, and I'm more than happy to walk you through the Regional Emergency Health Workforce Initiative, and as well as how we regionalize regional emergency health corps. So my name is Samara Al Mutawakkil. I'm emergency specialist and regional lead for emergency health workforce here in EMRO. In the first slide, I would start with the humanitarian. I'm sorry, Samar. Samar, can you please mute from your side because I can't hear your voices? Thank you. So the first slide, we will talk about the humanitarian landscape in EMR. As you may aware, the Eastern Mediterranean region is home to 745 million people. Around 19% of those people are in need of humanitarian assistance, which is around 140 million. Also, the region accounts for 55% of the world's refugees, and 33.7 million are IDPs. In our region, it's a highly demanding region where we deal with 13 out of 22 member states in the region are affected directly or indirectly by conflicts. 9 of our member states are classified as fragile conflict-affected countries, and 6 of our member states rank among the lowest globally for political stability. In 2023, WHO country offices and regional office, we responded to 73 graded emergencies, including 7 complex emergencies. 9 of these emergencies were classified as grade 3. After setting the scene, I would ask you to imagine with me the world where we were better prepared for COVID-19 in 2022. So if we can imagine all together, what if instead of reacting to the crisis, we were proactive and we had the tools and expertise to anticipate and mitigate the impact. Imagine that by that time we have our regional health emergency corps and global health emergency corps are in place, and how that could affect the pandemic and affect our reaction to the pandemic. Imagine we have national emergency multidisciplinary teams trained, ready for the response, and recognized the threats, ready, and were enabled to swift and coordinated response. Imagine that our regional leaders could have acted in union, could work together to implement measures like border closures, masks mandates, testing and tracing, effective containment of the virus and preventing its widespread. A nice story, yeah? So unfortunately, that was a missed opportunities, and we lacked the coordinated global and regional health infrastructure to effectively combat that pandemic. And what was the result? The result was millions of lives lost, trillions of dollars in economic damage, and the world forever, and a pandemic changed our world. So after that, and based on our context in EMR, in 2021, we started the concept of regional emergency health workforce. So, and our mission, our vision is how we can be fit for the purpose, how we can build a resilient, responsive, and a well-coordinated regional and national health emergency workforce. And our mission is, we thought that it's very important to build, train, and sustain a multidisciplinary team in the EMR to respond to national and regional crises. Based on that, we started with the Regional Emergency Health Workforce Initiative, and we started with a program called Leadership in Emergencies. Leadership in Emergencies is an innovative program in WHE, and which composed of 4 phases that are aiming to build the leadership, managerial, technical, and deployment capacities of emergency responders and leaders. It composed of 4 phases, as I said. The first phase is to build the leadership capacities, and it focuses on middle and high-level emergency managers and sectors who are involved in emergency management. And phase 2, in collaboration with Hopkins University, we held multiple trainings on public health skills in complex emergencies. Phase 3, it's about project management in humanitarian settings. And phase 4, in collaboration with Harvard, we conducted multiple training. We conducted simulation exercise on joint interdisciplinary humanitarian response and deployment simulation. To align that with other initiatives and global initiatives, we also collaborated in May 2022 with Africa CDC on a project called Joint Emergency Action Plan, which has 3 objectives. Objective 1 on surge capacity, Objective 2 in deployment, and Objective 3 on leaders network. And this is mainly to build the capacity of our of Africa continent and EMR countries in Africa continent. The third component of regional emergency health workforce is the adaptation of global health emergency corps framework to a regional context. And this, what I will walk you through in the next slides. So the GHEC concept is a concept focusing on 2 main items. Building national multidisciplinary or rapid response capacities, and the activity 2 is how we connect health emergency leadership for a coordinated response. If you can see in all of the aspects, you can see the leadership is a very prominent part of all of these components, and it's aligned with all of these global efforts. So let me introduce, today I will shed the light and I will give a specific focus to the concept of global health emergency corps. As you may aware of, there is something in WHO called the Health Emergency Preparedness and Response and Resilience Architecture, HEPR architecture, which is composed of 5 Cs: collaborative surveillance, community protection, safe and scalable care, access to countermeasures, and emergency coordination. And inspired by this architecture, we are working with our colleagues from HQ to introduce the concept of GHEC. So what's GHEC? GHEC is a proposed global network of emergency health teams trained and equipped to respond effectively to health emergencies. What it aims for? It aims to strengthen the national capacities through multidisciplinary team and regional leaders network to ensure coordinated and rapid response to outbreaks. As you know, central to any emergency coordination component is the need for a coordinated leadership, deployable and interoperable rapid response capacities. And as it shows you in this triangle, we are focusing on the 4 levels, which is the public health workforce, emergency workforce, surge capacities, and the senior level, which is leaders level, where we are introducing the concept of connected leaders. On the next slide, so this GHEC concept, it should be regionalized and adopted by regions. And why it should be regionalized is it's very important to regionalize the concept of GHEC according to each region unique needs and gaps. And the regionalization will foster strong partnerships between countries in the region, which will enable us to share resources, expertise, and best practices, as well as this collaborative approach will enhance our collaborative preparedness and response times, as well as it will enable us to save lives. So as I said before, we are focusing in two main components. It's multidisciplinary team, and the next one is leaders network. On the multidisciplinary team, I think out of the 22 countries, we don't have a single country with a national multidisciplinary team. We might have EMTs, we might have RRTs, we might have GORN, but we are not working in collaboration, and we don't have the concept of national multidisciplinary teams that can be activated by Ministry of Health or Public Health Institute to respond to national threats within 48 hours. So we came with this concept, why not to unify all forces and all initiatives and work under one umbrella and call it multidisciplinary teams, where we are suggesting to have a national team to build the capacity and to upscale or rescale the capabilities of experts in the countries to have a multidisciplinary team that composed of emergency manager, epidemiologists, logisticians, environmental health specialists, lab and RCCE specialists. In the beginning, it will be an emergency multidisciplinary team, but maybe in the second and third phases, we can also expand it to be multi-sectoral, multidisciplinary team, as we have to adopt the multi-sectoral approach in responding to emergencies. And this what we are asking countries today in our region to start investing in their national teams. We are happy to propose the concept and how we operationalize it and how we can work together to build a capacity of national multidisciplinary team that can respond to, first of all, a national threat, then if it's of a good capacity, can be deployed to neighboring countries in the region. And the second component of the Global Health Emergency Corps is the Regional Leaders Network, and why we wanted that, why we are focusing on that. So the World Bank have done an analysis of the pandemic and epidemic risks in 2024 and what are the drivers of pandemic and epidemic risks. And as you can see on the figure to the right, that governance, trust, conflict, and instability are ranked among the top 4, as well as climate change, and I can provide you with the link, ranked as the top 4 of the drivers to pandemics and epidemics. And as you may know, that building a trust should be during peacetime, it shouldn't be during a crisis time. And that's what we aim to, how we can build the trust among leaders in the peacetime. And we thought the best idea is to have a regional emergency leaders network who can influence the decision making. As you know, the health emergencies in EMR the health emergencies in EMR are often challenged by unique challenges. We have our region, unfortunately, we have limited technology, we have legal gaps, we have a variation in the health system capacities, we have inadequate emergency response mechanisms, and we thought the effective leadership in emergencies and the well-coordinated leadership network can affect the coordination of efforts across borders and organizations, and also can make critical decisions during times of crisis. I think learning from both past failures in Ebola and maybe sometimes in COVID-19, investing in a leadership and coordination is a must, and it would be more than just a network, but it's a building trust and fostering relationship between countries. And this will affect our immediate response to emergencies, because as you know, if we can align our resources and our actions, we can minimize the impact. So what's the key benefits and impacts of regional network of health emergencies preparedness and response leaders? As I said, that will enhance the coordination, strengthen the trust and relationships. That will allow these leaders to talk about surge capacities and deployments, and to operationalize the idea of surge capacities and deployments among countries. It will give us a platform to efficiently manage resources between countries in one region and in later stages among regions. And it will be a good platform for data sharing and communication, and those regional leaders will be also capable to be engaged to other regional leaders and to be part of the global health community. What we are looking for out of this is partnership and funding and investing in healthier EMR. As I previously said, we can't afford to lose more lives, or also to damage our economics again. And I think this is a golden opportunity during the peacetime, and I will say peacetime, or is not a peacetime in our region, but relevantly peacetime in some countries. We have to realize the full potential of regional health emergency corps, and for that we need your support, your endorsement, and your adoption of such an approach. Your contribution will contribute to achieve national, regional, and global health security. Thank you, and over to you, Samar.
Thank you. I don't know if Samar is still with us. Thank you very much. Of course, we can take forward any questions, and we can
Samar,
get back.
over to you. I'm not sure if you can hear me.
Yes, we're still hearing you. So I was saying thank you very much. And if there are any follow-up questions, we'll take them from there and we can share them back. Thank you, Samar. So before moving to the next presentation, or actually our regional discussion on the regional action plan, we're just going to share the video on Gaza operation that we missed in the previous presentation, and then we can move forward. Thank you.
The Emergency Medical Team EMT initiative is an emergency program led by the World Health Organization. Here in Gaza, we are having teams providing primary and secondary healthcare with different capacities within Gaza Strip.
We started this hospital on the 5th of January. We started with 178 patients on day one, and then the numbers reached up to 700 per day. And the count still goes on. The war is not over, and I believe the type and also the volume of patients will continue increasing as we approach towards possible extension of military operations.
What we've been able to achieve through the EMT coordination mechanism is to be able to understand the needs of the various health facilities and be able to provide particularly trauma care to a population which is really, really in need.
One of MedGlobal's specialties here in Gaza is increasing the local capacity of the healthcare system. We're able to see 400 to 500 cases here every day. Our specialty is maternal care. We have 11 other medical access points all throughout Rafah.
We observed that there is a severe malnutrition cases and mild malnutrition. So we decided with the WHO to do screening for these cases and to do early detection for the severe cases to be treated from our side and to prevent deterioration.
We already evacuate patients and we hope that we can proceed like this because there are many more people that urgently need better medical care.
EMT coordination, identify the gaps in the healthcare system, then bringing all the EMT leaders, focal points and health actors on the same table to have the most efficient and rapid response to those needs through the EMTs on the ground.
Thank you very much. As you know, one of the key priorities for EMT Global Meeting this year is the advancement of the EMT 2030 strategy. And saying that the AMRO has developed an action plan to support the advancement towards fulfilling that goal. Saying that, I would like to call the EMR regional representative, Dr. Samar Hamoud, to take us through the regional action plan for EMT 2030. Dr. Samar.
Thank you again for your time and the commitment to be with us this afternoon. So our last session, as I said earlier, is regarding the regional action plan. We're going to distribute copies of the main plan that we have been proposing and that I would be going through. So we'll be highlighting the main actions that are part of this plan. And we are relying on your contribution in terms of reviewing it and trying to propose some priority actions in the long list that we have put forward within that plan. So to start with, next. Of course, as you may know, the 2030 EMT strategy, it falls along 4 main strategic objectives. So the first one is through strengthening effective partnerships, leaderships, and operational governance. The second one, to provide comprehensive, accessible, and quality health services. The third one, implement, yes, thank you. I missed that. The third one, implement and scale up strategies for standardization and quality assurance. And the fourth is related to strengthening information systems, evidence, and research. So the plan focuses on 4 strategic objectives, and as we said, and I have presented them. And it offers a visionary roadmap for the 2024-2026 years, supporting the countries to achieve the EMT 2030 goals. So our regional action plan focuses in detail on the regional adaptation of these strategic objectives and the overall 2030 strategy for a better emergency response and health outcomes. So in terms of expected outcomes, again, it's like tailoring them to the regional context. The first one, to strengthen the governance of the EMT program in the EMR, better accessibility and quality of healthcare services during emergencies, quality assurance mechanisms for EMTs at national and regional levels are in place, And the fourth one, standardized information management systems for data collection, reporting, and coordination. As you can see, we have kept the main outcomes or the broad objectives within each of the strategic objectives and tailored them into our regional action plan to have regional outcomes. I will not go through the regional, as a background of our Eastern Mediterranean region. You have been, I think, hearing it about the context and how is it going on. However, I would like to highlight the need or the situation in terms of having diverse healthcare context. We have many challenges in terms of significant disparities in healthcare across the region and the capacities that are available within each country. We have a critical need. Effective emergency medical response is essential to reduce the impact of health emergencies and to improve the health outcomes in our countries. And we have a strategic focus. We need to have tailored approaches in order to address the unique needs and challenges within our region, within the context, and even within the national context of each country. So to guide you a little bit regarding the process of development of the EMT strategy, that went through a global consultative process back to August 2022 till December 2023, until the strategy was put in place and developed. Then we had the introduction to our, through the regional network or to the regional platform, through our first regional EMT meeting that took place in June 2023 in Tunisia last year. And then we followed it up through an engagement of regional stakeholders to build a shared understanding and set the foundation for national EMT capacity strengthening. And again, and this is the document that you have in your hands, we would move through or try to have a priority identification in order to define our EMR-specific outcomes or priorities, and these would form the basis of our regional action plan. So what are our next steps? And again, I want to highlight that the importance of our platform is used to have and to move forward with that regional action plan. We would like to have a consultation with our member states in order to gather input and refine this draft action plan. And the document that you're having, again, I'm saying it is describing in detail all the proposed activities within the 4 strategic objectives. And if it's possible, if you can go through, as I'm going to guide you through the action plan, and try to have some feedback on the prioritization of those actions. And we are hoping, once we collect the inputs from your end, and of course, we are not maybe representing all the countries in our platform today, but it will be the startup. It will be the first preliminary or kickoff of that consultation process. And then we would be finalizing it through a workshop in order to review, endorse, and to adopt our regional action plan. So in terms of details, regarding the strategic objective 1, as I said earlier, it's focusing on strengthening the governance by engaging countries and promoting the EMT methodology, as well as creating a regional governance structure and designating EMT national focal points. I trust that you are aware, or please be informed that like last April, earlier this year, a memo has been circulated from our regional director to the Minister of Health in all the 22 member states of our region, asking for the nomination of a national EMT focal point. So that person would be our interlocutor, it's like we have the aim, like we have the IHR focal point, it's to have an EMT focal point, whereby we could communicate and have this two-way exchange and moving on with the EMT agenda. So far, we have received 10 nominations. That means from 10 member states. We are following up with the other remaining countries to complete our the nominations in order to be able to create, as we call, the regional governance structure. Of course, it will have its own structure, it will have its own mandate, TORs, that will be presented later on. And actually, part of the memo that was shared with the Ministers of Health is the draft concept of that governing structure to be decided upon once the overall structure is in place. So the document that you have within your hands, it's the same that I'm reflecting on the screen. While you can see there are like some highlighted entries or actions, they are the same in the document that we considered as priority actions to tackle. The regional action plan is quite extensive, and we need to agree together how we could proceed with that action, with those actions, of course, once it is fully endorsed. So I will highlight a little bit under each of the main outcomes, what are like 1 or 2 key actions that we are proposing and that we would require your commitments later on. So under creating more engagement within the EMT initiative, we are proposing to conduct focused workshops to engage countries and stakeholders to emphasize the effectiveness of EMT tools and methodology. It's good to say that we are already doing that. So it's based on the request from individual countries. We have been in process of having those awareness workshops, introductory workshops, maybe not in person, but at least we started as virtual workshops to introduce the EMT initiative and methodology and put it forward. So as part of our plan is to continue into that perspective, because this is the entry point of the whole initiative. Designate, empower, and support EMT national focal points in the EMR countries to enhance their roles in the regional and national context in driving the EMT agenda. It is the same within the same scope that I have been explaining. If we move to the next one, so I will just like highlight or share the highlighted ones, but the whole document, as I said, is with you for further review and feedback. So under countries and regional, sub-regional entities to commit to adopt the EMT methodology to their health system, we are proposing to establish a systematic mechanism within our EMRO region to monitor and report on the progress of the EMR countries in adopting and adapting the EMT methodology. Again, to collaborate closely with the countries to develop a region-specific commitment and strategy for the effective implementation of EMT methodology. So it's a joint regional call. Of course, we are reinforcing and we are supporting the countries' initiatives, but we want to reinforce as well the EMT as part of our regional platform and context. Integration into regional agendas. Work closely with EMRO stakeholders to ensure alignment with regional priorities, including initiatives related to health emergency preparedness, response, and resilience. We have been mentioning trauma initiative, emergency care systems, and other initiatives that are in place. So we need to work collaboratively with those initiatives in order to have like one contribution. And again, referring to the previous presentation on the Global Health Emergency Corps, it feeds into the same approach. So having on the same platform the governments, the ministries, other stakeholders, as well as organizations. Establish regional governance structure committee to streamline decision making. So it all goes within the same context of reinforcing having that leadership and that governance that guides throughout in order to implement the EMT strategy. We were still in strategic objective 1. Strategic Objective 2, comprehensive, accessible, quality healthcare and services, and they would fall into two main sub-objectives. Aim to establish quality-assured national EMT capacities and timely activation mechanisms, as well as coordinate EMT response and ensure interoperability with other capacities. So the strategic objectives, they are, at the end, they are interlinked. Whatever we establish as governance structure and mechanism, they would feed into our operational implementation of the strategy. And again, we have a whole list of actions and sub-actions feeding into strategic objective 2. And as highlighted, just to guide you a little bit about what we could consider as some priorities within that strategic objective. Strategic objective 3, scale up standardization and quality assurance. So develop processes for EMT validation and integrate them into the national framework. Our objective as well is not to have only that international perspective and international classification. We want to reinforce the national aspect into the EMT implementation and expand the pool of regional mentors and establish minimum technical standards. So far at the regional level, we have concluded one training for mentorship training, and we have a pool of 26 mentors that are from the regions and that could support the mentorship process throughout the global EMT initiative. But of course, these mentors as well would be helpful in implementing the classification process and EMT within our region. Again, a whole list of actions and sub-actions. We count on your contribution. Strategic Objective 4, information management. Through the Gaza response, through the other responses that have been put in place, information management was identified as a key and important element in the EMT operations and response. So we need to enhance and having the necessary information management platforms to strengthen the data collection, reporting mechanisms, and information management tools, because these are the would show the products of all the operations and would reflect clearly what is being implemented in the field. And the other aspect into that strategic objective that we want as well to reinforce is with respect to research and to promote evidence sharing in order to support regional decision making. This is the high list. So in conclusion, our key messages: the EMT action plan that you have as a draft in hard copies, it would represent a bold commitment to strengthening resilience and enhancing emergency response capabilities across our region. And the success will depend, of course, on our collective efforts and collaboration in order to achieve all these proposed actions and our goals, shared goals. Thank you. So I don't know if you had the chance to to scan through the document. I know it's quite heavy. Maybe we can, at least from what you heard in the presentation, to get back from your end some feedback about the approach, about what we are proposing, and we could agree on the next steps in terms of like some time frame of reviewing this document. Of course, we will be sharing it again so that we can do the follow-up after that, our session. Let's say, agree on the platform or how we could receive at least the preliminary feedback into the prioritization. We are still here in the next 3 days. So if you have the chance of like reviewing the document and inputting even in writing some concepts or your opinion about such prioritization, that would be really helpful, and sharing back the document with us whenever you are ready to do that. And of course, we are available during, again, the next 3 days, and I think you are all on board, so that we can exchange further if there are any specific elements that we would like to highlight. Any specific questions or feedback? At least a commitment that we would move on for that regional action plan, and we can consider we are on the right track into that approach. Yes, Dr. Hamdan. Do we have a microphone? Ah, okay, thank you. It's working.
Wow. Yeah. My question is, we are in Libya. We are applying newly for this whole program. So how we more engaged in this strategy? That's my question. And next question, how we collaborate with the other countries for responses to any emergency in our region. So how to be putting inside.
So your first question, actually Libya is one of the countries that has provided the name for a national focal point. So we have the focal point on board. We can initiate the contact with that person, and even with yourself, Dr. Hamdan, because we are communicating already the next steps or how we could move on with the EMT in Libya. So we will activate and we'll follow up on that discussion in order to move forward with the needed action. Regarding the collaboration, I think our presence during this meeting, the global meeting, not specifically in the regional session, it's a great opportunity so that we get more introduced to, at least as a starting point within the region, how the initiative is progressing, how it is being advanced. And of course, it will be an introduction to share as well with other maybe partners and other teams in other regions to see different approaches. And this will enrich and give us more information and somehow experience and lessons how things can move on. And we are available at the regional office in order to enhance and engage, to have this bilateral even approach. So we can put forward the exchange, the communication with the teams, even if you have like some specific examples or situations, and we can put forward that collaboration and again helping in enhancing the EMT within Libya.
Thank you so much.
Okay. Okay. So I think we're done with the regional action plan. We still have for the regional session one last item. I missed mentioning it in the start of our session. It's related to the WHO policy brief on climate change. I'm not sure if you're familiar with that document, if it has been already shared with the different delegations and the members. And we were hoping to have that document has been shared, and we will send it again. It's meant to be for consultation, so we are looking for feedback and consultation from the member states and the partners by region. And feeding into that policy brief, so that if it is agreeable and we are fine with it, it moves on with the final endorsement and the publication. So any of the audience is aware of this policy brief on climate change? It was, I think, shortly introduced in the morning in the high-level panel. But the exchange or they were hoping to have like more feedback within the regional sessions. I don't feel that anybody is aware. So again, we're going to share it with with you, and we're hoping to collect again some feedback. It's a consultative process about the policy brief that WHO is proposing with respect to the climate change and the role of EMTs. Okay, Dr. Hisham, do you have any specific point to add? Otherwise, I think we could conclude our, you're fine? Any specific input as last? Because otherwise we could conclude our regional session. And of course, we look forward to keep in contact. And it was only, I think, the start to move on and bring us all together under one umbrella, which is the EMT, and we could move on with our next steps. Yes.
Thank you for the session. Just one comment for Dr. Hisham, because there is no time to comment after his presentation. So it was a wonderful presentation, great efforts conducted by colleagues in Saudi Arabia. As he mentioned also, there is annual experience, normal occurring exercise during Hajj session. And this experience in Saudi Arabia, it's accumulative. We would like to see this experience shared with other countries in the region. Our region is full of a frequent crisis. We would like to see Saudi Arabia, the EMTs, participating, not covering only Saudi Arabia, also beyond the border. So my question, based on the strategy, we are happy and hopefully that we see our colleagues from Saudi Arabia classified as EMT soon, inshallah. But the question, what is the timeline and what is the scope and vision for Saudi Arabia to be classified as type 1, type 2, type 3? What is the vision? I am very interested to see a regional country or country from the region classified as EMT. For that, I can't wait until to know what is your strategy. Thank you.
Thank you for the question. So I have a good news for that, actually. Regarding type 2 classification, as I mentioned earlier, we're just 2 steps away from being classified. And from our end, we already fully deployed in preparation for those visits. So whenever a date being designated from WHO, then hopefully we'll get the classification. Now, as far as the strategy concerns, as we speak and during the process of classification, we already started preparing for the classification for type 1. So our plan is to have that started in 2025 and finalizing the whole process by the end of 2026. The other good news is that we have the full support and the direction from the country leadership and His Excellency, the Minister of Health, who directed to move forward towards the classification of type 3 as well. So yeah, we're getting there. However, from priority standpoint, we prefer to start by type 2, move into type 1, and at the same time, we prepare for type 3, and we have good opportunities in the coming years, inshallah, that can expedite this process. For instance, we have in 2027 Asia Football Cup, which is another mass gathering event, and we have Expo 2030, and we have the World Cup 2034. So all plans are there in place. So from a timeline point of view, it is start by type 1, 2025, and after the classification of type 1, we'll start working on type 3. Thank you.
Any other specific questions? Yes, Dr. Rashad.
Sorry, we're going to bother you also, Saudi Arabia, because you are that close to classification, which would be a very good news to the region. As the first team that is hopefully soon will be classified in the regions, you have been spoken about your strategy to deploy it inside the country. So I would like to ask you about the strategy, the plans, and how do you see your role in the regions? Well, that's one of the strategies. Vision for the EMT is regionalizations of the response, which is something you are that close to do. So if you can elaborate more on this, the regional role for the team. Thank you.
Thank you for the question. Very important point. Basically, that's one of the steps that we covered in the past 2 years. So in order to strike this balance between the national and regional capacity building, we are about to finalize the memorandum of understanding with King Salman Center for Relief, saying that our plan is to support regional emergency response in collaboration with other national teams, King Salman Center, Search and Rescue Team for the Civil Defense. So saying that this is already in plan, and the only thing that we're waiting for the time being is just a classification process, you know. But again, it's very important to strike this balance. We need to think about the regional efforts as well. And saying that, that doesn't stop us also to work. I mentioned earlier that the National Health Emergency Operations Center is already designated as a collaborating center with the WHO. So awaiting for the classification, we also collaborating with our member state partners by sharing experience and supporting capacity building activities is all elements related to health emergency. Yeah. Allah yatikum al-afiyah. And I would like to add that, saying that, please, the National Health Emergency Operations Center is designated by the WHO, and part of our term of reference is to support member state. So we're happy to support all the EOCs and member state in any areas related to emergency management. Thank you.
Thank you, Dr. Hisham. Yes.
Hi, the questions for Dr. Hussam. With the situation in Gaza, have you guys think about moving the EMTCC to Jordan maybe? Since the Cairo borders, the Egypt borders are blocked.
Actually, this is a very good question. Yes, we start in Cairo because the geographical axis was in Egypt. And now we are deploying in monthly base coordinator or deputy to Jordan. But we are thinking to have also sub-office in Amman to support the deployment through Jordan, yes.
Actually, as it was introduced, the Gaza operation is really specific in its modality. So in order to have the better response and the best mechanism, this is like the approach that has been in place. Otherwise, I think from EMTCC coordination, usually it is within the country itself or in the field itself. But as I said earlier, and of course Dr. Hussam has explained it, Gaza is quite complex in its response, and it had it led to, I will not say innovating, but establishing or proposing new mechanisms in order to support the operations in a better situation and a better way. Okay, I think we have a break, or I'm not sure about the timing. There's a break. Okay, so we can have our break, and we'll check. I think we can continue after that with our regional session, maybe to share a little bit on the policy brief for climate change, so that you are more aware of the context, and if it is possible to have some feedback on the content. Okay, so I think it's like 15 minutes or 15 minutes. Okay. So we'll reconvene in 15 minutes. Thank you. So we're going to have our last session on the policy brief, climate change and EMT initiative. We're going to present that policy brief into specific content or information, so that you can have an idea about what is it about. And we're going to share the draft policy brief, as I said earlier, for further consultation. But of course, looking to hear back from your end after the presentation, if there are any quick somehow ideas, feedback, your perspective about the policy brief itself. So this draft policy brief, as it is called, EMT Initiative and Climate Change, it has been drafted by the EMT Secretariat in partnership with WHO Climate Change and Health team, who is the team working in WHO HQ, which is outside the Health Emergencies Program. And it was a joint work, and the output came out with that draft policy brief. So we must be prepared, because the next pandemic or climate-related event is not a matter of if, but when. We know that climate change or such type of events, they are coming. So the time to act is now. And disaster risk is magnified by climate change. It can increase the hazard, while at the same time, it decreases the resilience of households and communities. Increased risk necessitates increased investment in preparedness and response mechanisms. Greater effort and investment are needed to improve emergency response to extreme events and its adaptation and resilience to climate change. So the purpose of the policy brief is to outline the interconnections between climate change, health and emergencies, and specifically the Emergency Medical Teams Initiative. It aims to develop mutual understanding of these interconnections and propose potential areas of action to enhance operational readiness and response and capacity building. These actions would contribute to building the resilience and reduce the greenhouse gas emissions of health systems in response to the climate crisis. The WHO emphasizes the critical intersections between health and climate change, highlighting the importance of integrating these connections into EMT standards and operations. So this is a basic overview of the emergencies landscape in general, and the EMT initiative in terms of having classified international EMTs, EMTs undergoing global classification, what are the countries that are ongoing or are having the active classification process of EMTs, and a total number of 30,000 responders. As part of the policy brief development, a literature review was conducted in order to demonstrate a clear evidence base of the climate change impact on emergencies and possible outcomes. So this virtual, or this slide, it's presenting an overview that is further elaborated, of course, within the policy brief itself. And it's clearly showing the climate change impacts on health emergencies, where with the increased frequency, increased severity, and increased complexity is leading to possible emergency outcomes that we are all currently realizing, in terms of vector-borne, waterborne, and zoonotic diseases outbreaks, food insecurity and subsequent malnutrition, mortality and morbidity related to environmental pollution and or traumatic injuries, forced migration and displacement of populations, conflict related to the resources that would become scarce, and health system strain or even collapse due to climate change events or climate-related events. This slide will show us a causal pathway, which is a way to demonstrate the interactions and the causal relationships between the climate change and the health emergencies. Similar to what is often discussed within the concept of disaster risk reduction, specifically in the literature of disaster risk reduction, and in practice, it demonstrates that the risk of health emergencies, in our case, can be measured through the compounding relationships between vulnerability, hazards, and exposure. Health systems, including surge preparedness and response, are resilient and well-resourced. So the risk of health emergencies is lessened. On the contrary, if the health systems are weak and do not have the capacity to surge in response of the increased demands and challenges that results from climate change, among other factors, there is a serious risk of health emergencies. And this risk may be related to increased frequency, intensity, complexity, or a combination of the three. So it's a clear demonstration of the causal relationship between climate change and the outcomes or the impact that we have highlighted earlier. Health systems, including surge components, also contribute to climate change through greenhouse gas emissions and other environmental impact, which is as well reflected on that slide. So the draft policy proposes 4 overarching recommendations, which are: integrate climate change considerations into emergency preparedness and response programs, integrate emergency surge response within policies and program dealing with climate change and health, promote a multi-sectoral research agenda to strengthen future evidence-based actions, and address the large gaps in funding for implementing adaptation and mitigation measures within emergency health response. Our focus is on the first overarching recommendation, which is integrating climate change considerations into emergency preparedness and response program. And this can be further elaborated in the final section, or you can check it when you are going to see the policy brief. So it is further elaborated in the final section of the policy brief. The WHO operational framework for building climate resilience and low-carbon health systems was adapted of the emergency concept. Under each of the 10 components that we are seeing on the screen, we have proposed activities that are either adaptations, adapting surge programming and programs to meet the changing and complex needs that are related or created by the climate change, or even mitigation, activities to reduce the carbon footprint of surge activities. So to address the first recommendation, these can be the proposed actions, as we are saying. They are either adaptation actions or activities, or certain mitigation activities that can be put in place in order to address the climate change. So that is, in principle, just a brief overview of the policy brief. If you can have any feedback or any somehow idea, first, like of the concept, of the content, of course, you are welcome to share now. Or otherwise, as we said, we'll try to share the policy brief as a document the soonest with you, so that we can collect back your feedback. And this is mainly for consultation because endorsing and publishing the policy brief would be based on such consultative process and feedback from all. Thank you. Any specific comment? Diana? We're going to deal all with climate change. Okay, sure. Yeah, and adding to that, because as part of the risk assessment or the risk profiling that we are implementing with countries, even for countries that have it in place or they are in process of updating the risk profiles, climate-related events or crises, they have been somehow rated based on the vulnerability and the capacities in certain contexts as high, like high or very high priority. And accordingly, as you're saying, Dr. Soha, definitely clear actions will be identified. Maybe in certain situations, specific hazard or climate change or climate event contingency planning is needed if those types of hazards, they are very prone to happen in certain contexts, and we need to be somehow ready and prepared to address them when they occur. Yes. That's quite important. I think part of the recommendation on maybe research and like elaborating further into what is there would come up with certain actions that would feed into the learning and into embedding the concepts from the start. It's like as part of building the capacities and the knowledge and trying of practices for the generations to come. It's not like to be only, it's part of the preparedness as well, actions. Although now it's very, very clear, like we are witnessing, for example, like the flooding in Sudan or any other country, and what's next in terms of vector-borne or any waterborne related diseases. So definitely, they are interlinked. So maybe the evidence that is in the policy brief or the references that are there would put more somehow again evidence and references into the future actions that would be taken in the different sectors, not only related to the health specifically. And when we deal with climate, actually it's multi-sectoral because you have the other ministries than the Ministry of Health, like somehow directly involved, and even the community because it's part of the whole approach. Any other elaboration or feedback? But we'll take your point and we'll deliver it to the secretariat. Thank you. Okay, we are clear. Okay, thank you very much for your time and for your commitment. Hope it was really a beneficial session into somehow exchanging our regional context, and it's only the start. As we say it always, now we build on such platforms in order to move forward and get connected more and more from WHO, because I am from WHO, and of course with the member state, but more importantly, the member states and the countries between each other and even partners across each other. Thank you.